Hello, everyone. Thank you all for joining us for this roundtable. As a reminder, this meeting is being recorded and will likely be uploaded online. So if you turn your camera on, your video will be recorded. Welcome. I'm Dr. Mojtaba Moharrer, co-organizer of the Mobility Roundtable, based at the Skapens Eye Research Institute, Mount Sinai of Harvard Medical School. I will be starting the roundtable and introducing the speakers. My co-organizer, Dr. Andrew Tomlinson from the University of Leeds in the UK, will guide the Q&A and close the session. Mobility and health are intricately linked, impacting societies and individuals in positive or negative ways, which include air and noise pollution caused by public and private transportation modes, health and environmental benefits of active travels, decreased access to economic opportunities, and much more. Yet to speak about mobility in these early months of 2020 also requires attention to the interruption caused to mobility, transportation, and travel choice by COVID-19. So we have a very diverse and great roundtable and speakers for you. We will jump right into it with our first speakers and let them guide and go through the talk. Dr. Haneen Khreis is an assistant research scientist at Texas A&M Transportation Institute, environmental and health impact of urban and transport planning. Haneen, please.
Thanks for inviting me to this. I'm really looking forward to hearing the other speakers as well and to the discussions. So I'm going to start with a really higher level overview of how we think about transportation and health and the impact of transportation on health and through which pathways it occurs. We've been working on this topic for quite a few years, and just recently this year, we kind of came up with this framework that lists all the different linkages, and I'll briefly go through them. But I think before, just as Mojtaba said, we are seeing a lot of changes in the transportation sector right now. You know, for some people, we might have thought that infectious disease is a problem of the past. We got a sore reminder that this is not the case, and that the transportation system and our activity patterns are really susceptible to a public health crisis like that. But on the other hand, we're also seeing emerging transportation technologies in the transportation sector, like connected and automated vehicles and electric vehicles that are bound to change the way we travel, and also the different exposures, beneficial and detrimental to health. And these are issues that I'm not sure we fully understand yet. Generally speaking, you know, when it comes to health impacts of planning, specifically transportation planning, policy has been generally more reactive than proactive. We've seen it with the diesel car boom in Europe, for example, where there was a focus on one issue related to transportation. In that case, it was climate change. And a whole huge change in the manufacturing and sales and the promotion of diesel vehicles happened, to find out later that there were so many negative unintended consequences on air pollution and health. So one of the kind of reasons or rationales behind our work is to try and frame all the different linkages between transportation and health. So when we think about mitigation strategies or policies to promote healthy mobility, especially in cities, we can think about these issues more holistically. So just kind of a look back into the past, I think the way we've thought about transportation and health, we thought that they're linked through three main pathways: motor vehicle crashes. So traffic safety is a big issue in the transportation sector. It's a big part of transportation investment appraisal and also the resources that are put into a transport planning and policy. And it's a huge issue. For like the World Bank estimates that 1.5 million deaths and almost 80 million injuries per year around the world are a result of motor vehicle crashes. So it is a huge issue. But we're also finding out that other exposures are coming to the top of the agenda for policymakers more recently, such as ambient air pollution and physical inactivity. And these two exposures are tightly linked to transportation. For example, ambient air pollution has been estimated to be responsible for 4.2 million deaths around the world per year. These are not all linked to transportation, but an important part of them is, and that's modifiable. And for physical inactivity, 3.2 million annual global deaths a year are a result of physical inactivity. So this is, you know, it's a public health, I would say, crisis. But again, these are modifiable numbers that can be changed by changing certain transportation planning practices, especially in cities. And cities are a very important unit, I think, when we talk about mobility and health, because of urbanization and because they're kind of exposure hotspots where people are there and they're, you know, in relatively dense areas and are exposed to all these different exposures at a higher rate. So cities are a very important, I think, element in this discussion. So just kind of, I have 2 more minutes and I just want to give you some indication of the work we've been doing in cities in relation to transportation impacts on health. So we had a couple of studies published this year in Houston, Texas, and in Barcelona in Spain, where we looked at different exposures related to transportation and estimated their impacts on health using like standard burden of disease assessment frameworks. So for example, in Houston, Texas, what we found is per year, there are 330 premature deaths that are happening because of motor vehicle crashes. When we look at these numbers related to air pollution and transportation noise, related to air pollution, we estimated that 630 deaths per year occur because of PM 2.5 exposure, while transportation noise is responsible for just over 300 deaths. In Barcelona, in Spain, 30 premature deaths were recorded because of motor vehicle crashes, while when we look at different exposures related to transportation, including physical inactivity, air pollution, traffic noise, heat, and the lack of green space, we estimated that 2,900 deaths are related to these exposures. So 10 times as much as that burden related to motor vehicle crashes. So I just kind of want to put that out there because, you know, safety is an important issue, and I think it's gaining a lot of attention even in new upcoming policies, like when we talk about autonomous vehicles. That's one of the key cited reasons for the promotion of this technology. But when we look at the kind of holistic spectrum of all the different exposures and all the different health outcomes of transportation, I think we need to start putting things into perspective a bit better. With that, I think, Mujtaba, I'll end.
Thank you very much. Perfect. We will come back to your points. Now I invite our next speaker, Dr. Xavier Brice, Executive Officer of Sustrans, a nonprofit organization in the UK that is making it easier for people to walk and cycle. Please, Xavier.
Great, thank you, Mujtaba, and thank you, Haneen. As Mujtaba said, I lead Sustrans, which is a non-profit in the UK with a very simple mission, which is to make it easier for people to walk and cycle. But that is in service of a much more expansive vision, which I'm probably going to focus on initially, which is to see a society where the way we travel creates healthier places and happier lives for everyone. And I want to focus on 2 aspects of that. First, we talk about healthier places, not people. This isn't about haranguing overweight people to cycle and walk. People are products of their environment, and the environment's a consequence of choices made over generations, and we think we can change that with others. The second point is for everyone. Typically, the benefits of walking, cycling tend to accrue to the worried well, while the disbenefits of poor transport choices tend to impact those who are worse off in society. And that is thrown into sharp relief at the moment with the structural inequity that we see being raised through the Black Lives Matter campaign, and it is a real live issue within our sector, I believe. So, so walking and cycling are a hot topic here in the UK with COVID. Our Prime Minister is going to launch a new cycling and walking plan, the emphasis on the cycling, at the end of the month. A vision for cycling in the UK, which we're waiting for. And there has been unprecedented levels of investment announced. But before talking about walking and cycling, I want to pick up to Haneen, who follow on from Haneen, who talked about sort of looking at transport and health holistically. But with I'm going to do it with considerably less rigor. So bear with me. I'm going to talk about teleporters. So, see, teleporters don't actually exist, do they? I mean, somebody can correct me in the question session. But like many things that don't exist in society, they underpin much of what we do and much of what we believe. And I think they underpin our thinking on transport in a fundamental and fundamentally flawed way. I think, you see, teleporters, for most people in transport, it's the ultimate goal. It's the platonic ideal that everyone's working towards. Because most transport technology is still about making journeys quicker, more convenient, seamless. The faster, the better. Yeah. The private motor car was a big step forward, door-to-door journeys. The autonomous vehicle will get us closer to that nirvana of a teleporter, and witness the rather loopy Hyperloop as another example of that. And if you don't believe me, think about how transport investment cases are made, which is all about rewarding reduction in journey time, take to its logical limit 0, and then costing externalities. So back to our teleporter is the ideal, isn't it? It would ace any transport business case. The externalities are meter square and some renewable energy to power it, and ching, you can go wherever you want. Yeah. So if it's a platonic ideal, what's the problem with that? Yeah, well, why is that a problem? Not least because it doesn't exist. Well, the problem is we are trying to engineer away the physical nature of movement. And you can't escape the physical consequences of travel. For all the talk of smart or digital transport, yeah, smart mobility, unlike video, unlike meetings, unlike a seminar, you cannot digitize travel. Yeah, it is irreducibly located in time and place. Yeah, irreducibly located in time and place. And indeed, to move is to be human, which is something I think we've all felt more over the last few months. So in other words, if you tend to think about transport in that way as something that's about minimizing time and space, then their externalities, their inconveniences, and witness all the negative health impacts, the biggest of which is clearly the significant contribution of road transport to climate change, let alone the violence done by traffic, the air quality, all the other things, yeah, and fundamentally the fact we're expanding energy in order to do something our muscles can do. And I'd say instead of thinking about travel as an inconvenience to be wished or engineered away, we need to think about it as bound up with how we want to live. It's a moral question, and it's a question at the heart of the human condition. So what's this got to do with active travel? Okay, so if instead of thinking about mobility or transport as a necessary function or a given that can just, you know, some version, not quite as good as a teleporter, but getting there, will come in and help us. Instead, if we thought about designing and living in a way that took into account human movement, we'd have less movement but more human contact and certainly a healthier life. And I mean, the Barcelona versus Texas is underpinned by very, very different urban land use, for example. So, and a practical example of that is the concept of 20-minute neighborhoods, which I'm sure many people are familiar with, which is the notion that most of what you need can be got in a 10-minute walk, there and back. And Melbourne's approach to city planning is founded on that. And those are journeys that can be walked or cycled if you want to do it quicker. It sounds crazy, doesn't it? The idea that we can live within a 10-minute radius of anything we need. It sounds completely insane. Whereas getting on an aeroplane, right now I could call up an Uber, go to Heathrow, which is 10 minutes away, jump on a plane, fly to the other side of the world in a matter of hours. That is normal. But the notion that we could live with most of our daily needs 10 minutes away is somehow crazy. And yet, right now I'd struggle to get on a plane to Australia because there are less of them. And indeed, here in the UK, many of us, with the exception of maybe a government advisor or two, have been living within 10-minute boundaries. So it's not completely fanciful. This isn't a fantasy. It's a sustainable human way to live. So underpinning, you know, changing the conditions around us, make walking and cycling, make active travel an integral part of how we live, not just a replacement of an existing mode. But back to the paradigm we operate in now. First of all, the health benefits of walking and cycling are overwhelming. I won't rehearse them, but I think that fundamentally, if you think about why should we look to get more people walking, cycling, it is not just the impact it has on the individual, it's the wider impact on public health. So this is less about the individual benefit, it's the wider impact of more people walking, cycling, and the reduction in air pollution, which is 5,000 premature deaths here in the UK, the reduction in road traffic accidents, and all the rest. And of course, people who walk and cycle, you might then think, well, they're more exposed, for example, for air pollution, which is not the case at all. People who walk and cycle are out there in polluted traffic, are less exposed to air pollution than somebody sitting in a vehicle in the same traffic jam that's causing the air pollution. So, so even if you don't look to divert people, which is now happening, to routes that are less polluted, you're better off walking or cycling than being in the car. In terms of fatality levels, more people walking, cycling leads to fewer accidents. Countries like the Netherlands have fewer accidents from, fewer fatalities from cyclists in particular, not just relative, but absolute, because more people do it, it becomes safer. So, and just on the Netherlands, people sometimes say, well, here in the UK, or the US, how can we possibly be like the Netherlands? Well, of course, the Netherlands wasn't always like that. Amsterdam had public transport, but it used to be that the streets were given over to cars. Change is possible, but it takes time. And over 10 years ago, I worked on the walking cycling strategy in London when I was at Transport for London. And at the time, people, when I was working on this, would say to me, yeah, it's all very well to talk about Amsterdam, but London's not the same as the Netherlands. Right now, there is work going on in Manchester, led by Chris Boardman, the walking cycling commissioner there, to make Manchester effectively more like London, more like Amsterdam. And people say, it's fine to talk about London, but Manchester's not like London. And eventually you run out of examples. So, so change is possible, and indeed London shows that. London is no cycling nirvana, but it is a lot better than it was. And right now, every day there is more space being given over to walking and cycling because of the impacts of COVID. And the recognition that public transport is going to need help in the short term to carry people, and that's got to be about allocating space away from the private vehicle to walking, cycling, and the money is being put behind that. So, so I'll end there. My time is up, and hand back to Moshaba.
Thank you very much, Xavier. Beautiful. We will come back to your talk again, to your point of it. So I now invite our next speaker, Dr. Alvaro Guzman, Strategic Advisor at Cercana Consultancy in Ecuador. Alvaro is known for being passionate for sustainable mobility. Alvaro?
Thanks for the invitation, Andrew, as well. I'm glad to share this space with all of you guys. Well, let me take on my notes. Yeah, well, transport is directly related with health issues. I don't believe there is much argument against that. From road accidents, which leaves millions of fatalities in our roads and dozens of millions injured, to many more millions suffering the effects of pollution and greenhouse gases all over the world. Here in Ecuador, more than 2,000 people die every year in road accidents, and more than 30,000 are left with injuries. Before the COVID crisis here in my country, up to 60% of IC units, very much needed in COVID times, were filled with injured people in road accidents. Last year, as head of the National Transit Agency, we managed to implement a nice set of policies with important results, particularly in intercity transport, where a 45% decrease in accidents was achieved, which meant a 78% decrease in road deaths and an 11% reduction in injured people. We did focus in intercity transport because it was the right thing to do, and there was a lot of media and political pressure to do something about it. What is important about this little story is that intercity accidents had been the biggest transport issue in the country for over a decade. And we showed that with very little funding, if the right set of policies are implemented, outcomes that may seem impossible are definitely achievable in a very short period of time. At the city level, as my predecessor said, active travel has been proved to be one of the most successful strategies to improve transport conditions in our cities. As we pacify our roads and create more space for walking and cycling, less accidents happen in our cities and less emissions from tailpipes are emitted. The COVID pandemic is creating a unique opportunity for active travel policies in cities, particularly in Ecuador. Currently, as part of an ongoing project with the World Bank that is trying to understand the effects of COVID in transit systems, we have run an online control survey that has given us very interesting insights into how people are going to change transport modes in the future. Before the presence of COVID, 61% of the population at the national level was using transit, and a fall of 13% is expected to 48% of people willing to use public transport. In Quito, in my city, a decrease of 18% is expected from pre-COVID use of 73%. This is the result of a series of unsustained news about danger of COVID in public transit systems. As a result, there is an increase of vehicle travel of about 1%, but there is an important growth in active travel of 11% at the national level, with the larger share of the growth in cycling, as it goes from 4% before the COVID to 12% after the quarantine. The values, of course, change from city to city, but as an example, in Quito, cycling grows from less than 0.5% to 9.1%. And you can actually see it and feel it. It is not quite Amsterdam or Copenhagen yet, but there are many, many cyclists on our roads these days. These numbers show a unique chance these coming months, and a window of opportunity is definitely set for the implementation of sustainable transport strategies here in Ecuador and in many other countries. If the right set of policies are applied, there's a huge potential for big uptake of active travel in Ecuadorian cities with all the health benefits that it brings. The challenge is identifying the right set of policies in a low budget context with very short time of implementation. We cannot let go of this fantastic opportunity. Thank you.
Mojtaba, you're muted again.
Yeah. I want to see if you're able to read my lips. I invite our next speaker, Professor Xavier Brice, Director of Program in Environmental Design at University of Colorado, Boulder. Please go ahead.
Great, thank you so much for the invitation. I really appreciate hearing the perspectives. And I think I want to try and just build on them really quickly and see if there's an opportunity to push what we're hearing to the next level. But at the outset, there's at least 3 points that I think are important for us to premise our understanding and my comments. The first of which is more or less we're dealing with mature systems here. We're dealing with mature systems insofar as how land use elements engage with transportation networks. That's important because there's not a lot of change that is possible in mature systems because everything is already kind of working together. And so we have to understand that that is an inherent limitation where we can think through what types of opportunities will allow, what types of opportunities are most appropriate for that particular system and how to make it grow. Okay, the second point is that as most of us know, there's a lot of space that is out there devoted to streets and roadways. Almost a third, sometimes more than that, of the total land area in cities is devoted to just the movement. And we all know what has prioritized that movement for the past century almost, okay? Now, piggybacking on that, the third point is that, you know, over the past 5-10 years, I think that there's been a noticeable uptick in the number of claimants, people who are trying to claim some of that space away from the automobile, okay? And we're not just talking bicycles, we're talking bicycles and electric scooters and, you know, and increasingly autonomous vehicles and hoverboards and everything. There's been a Cambrian explosion, if you will, of different mobilities that are enabling people to think through how they're going to get from point A to point B, and riffing off the mention earlier that yes, physical travel is still going to be with us. We just need to figure out ways that that physical travel can still allow us to get those distances that we want to get, but in more environmentally and socially conscious ways. Okay, so with those three premises as the background for some of my comments, what we saw in kind of mid-March was a rapid transformation in how those spaces are used. And this was the first time that we've seen in many generations how a wide swath of city street space has been transformed overnight. So we tend to think of street space as, you know, perennially always serving the car, and the car having the primary prerogative on street space. But now, you know, what we saw in March is within, you know, a week or two, almost every street in the world became totally dormant. Now, in response, what we saw was elected officials, mayors, city council members, slowly thinking about how we can repurpose some of those spaces, okay? And so we know that we saw now, there's almost 500, 600, 700, I believe, cities on that database that are suggesting some sort of repurposing of that street space away from cars to something else. Now, initially, those efforts were motivated by social distancing requirements. Then we saw them be kind of transformed to how can we get the workforce moving again, given limited transit service. And, you know, recently we're seeing, at least in the US, a lot of these spaces being turned over to restaurants to aid in economic recovery. But cumulatively, these are all suggesting, combined with these other additional claimants, that, you know, we are at a turning point, perhaps, of turning the faucet off on cars and turning the faucet on to more human-scaled vehicles. And what we know now is, with advances in technology, is that human-scaled vehicles, they really can do a lot more for us. And when I say human-scaled vehicles, I'm using bicycling as the North Star here, if you will, but there's many other ranges of mobility options that fit into that, dimension, where, you know, cars are taking so much space. But if we just think of either smaller cars or larger cargo bikes or even bicycles or skateboards, you get the idea here. Consider that there's a lot of activity in this. Now, what is holding that back right now is the fact that they have to share a lot of that space with cars. And if we can figure out a way, a strategy, where we can dovetail all of these forces and allow them to merge in ways that we have not in the past been able to synergize, I do think that there is the possibility that many cities are on a tipping point here. Now, what we have here is a challenge of figuring out how to make sure that those dovetailed, or make sure that those incremental changes, a lot of the changes that cities are doing are, you know, there's a spot over here, a street over here, or a square over here, and they don't form a network for movement. And the network for movement is absolutely essential and imperative. A network that is safe and continuous. We too often think about bike lanes and not enough about the intersections. And if we can strategically make street allocations, reappropriating, shifting space away from streets meant for cars towards streets meant for human-scaled vehicles, I think that we can see a kind of a sea change in how that network will be created. And this abides by some of the fundamental tenets of how networks grow. We have to get past that initial elbow on the curve to think about how we can get from this nascent point to past that elbow, that inflection point, to quick acceleration. And COVID is certainly going to allow us to jump on that curve a little bit quicker, but it's not necessarily going to be nearly enough. So I think that the strategy here is to really try to understand where and why and how strategic decisions to where streets are going to be transformed are going to be made in cities to allow that network to quickly grow. Thank you.
Thank you very much. Oh, beautiful. Very nice transition for all the speakers. I will actually now hand back to Andrew to guide the Q&A. Please, Andrew.
Okay, yes, thank you. And thank you very much to all the speakers. There were four very powerful and informative presentations there. So just for the benefit of the audience, we asked the speakers to think about some questions that they would want to ask the other panelists. So we're now going to invite the speakers to perhaps ask one of their questions and of the other panelists. Maybe Haneen would like to start with that.
Yeah. So one of my questions was about in the context of COVID-19, I've been hearing a lot of talk about how some of like the most promising strategies for health, like for example, making land use diverse and dense in cities to promote active travel, can have negative consequences when it comes to infectious disease. And, you know, this issue is now brought up and is a more important issue. So I guess my question to the speakers is, do they agree? And then do they see some ways around it where if this or when this happens again, there can be a containment of an event like this, and at the same time, we can promote, you know, that kind of land use for active transportation.
So Xavier, would you like to come back on that one, maybe?
So I think it's not something we're seeing signs of yet here in the UK, but it feels like a sort of the wrong way to approach the problem. So the pandemic, like the influenza epidemic, will be forgotten eventually. But there's huge risk of other pandemics, and I believe the UN a couple of days ago said that the pandemic was basically that there's risk of greater pandemics because of the destruction of wildlife and of green space more generally, and I think that it's going back to what the root cause is. So I don't think that living a more suburban, because where it takes you is a more suburban lifestyle. There's talk here of people moving out of cities as we realise you can work at home. And the dystopian land use patterns that leads to. So I think that it's a risk, but I think it's one that should be challenged, because I think the pandemic will be contained within a fairly short time frame, and we should be looking at root cause, not the surface issues. And I think a far bigger threat to us, of course, is climate change, which hasn't gone away. And denser land use is absolutely a response to that.
Mm-hmm. And climate change is obviously related to the pandemic as well. So that's a good point. Yeah.
Okay, thank you for that. Alvaro, do you want to come in with a question? I think yours was quite relevant at this moment.
I wanted to add to Haneen's question just very briefly. I think that, of course, all these news that are coming out about density and that people are talking about it, we have to be really careful and not to confuse densities with agglomeration. That's something that is really important, definitely, because there is a problem in agglomeration, particularly in shanty towns and that sort of places in our cities in the developing world, where it is a huge problem. But I do believe that there's an opportunity to keep on improving the densities in our cities. I think it's positive to do that in order to achieve our aims of active travel and health objectives. That I wanted to add that. I have a question for the panel. I'm really interested about learning about other people's errors. And what I was thinking is, okay, what are the sort of things that we should avoid in countries, in cities that are just starting to think about cycling or active travel? What are the sort of things that you believe we definitely should avoid doing? That may seem like a good idea at the beginning, but then after a few months or after a few years, you realize, no, maybe this wasn't the way. So I know contexts are difficult, contexts are different, but if you could talk to the audience about what sort of stuff should definitely be avoided. Thank you.
So do you want to go first with that, Kevin? Yeah, thank you.
I think what we're going to be seeing over the next couple of years is active discussions about the appropriate use of a socio-technical, piece of technology, and that is street space. If we think of streets as a technology, okay? And so what we want to do is see what we want to do, I think, but what we want to do is not necessarily coinciding with what the politicians want to do. And so what we need to do, what I think a challenge is to help convince the politicians that there is an opportunity that is before us, there we can reappropriate street space away from cars and towards these other type of modes. Now, the common criticism is what happens when you put a bike lane in and nobody starts to use it. A lot of research, it suggests that we are putting bike lanes in where people use them, and if you build it, they will come. But a lot of times we're putting bike lanes in and they're not being used. We're not really getting those, we're not seeing that. But those are on the political register here. And if we make these kind of aggressive decisions, or if we see politicians be making those aggressive decisions, they want to see immediate payback. So I think to respond to the question, what we're seeing, I think, is a lot of gratuitous bike lanes be placed in inopportune locations in cities. They're really being given kind of just, okay, oh, look, we did this. But we have to think through, and sometimes they're being done on account of equity. So this neighborhood needs a bike lane, that neighborhood needs a bike lane, this neighborhood needs a bike lane. But by doing so, we're unable to leverage the network effects that I was talking about earlier. And so one of the harder things for politicians and elected officials to realize is that I think we need to understand that we need to build bike lanes, for example, in areas where other bike lanes are built to allow that network to grow.
So that's a very good point. So Xavier, do you want to?
Yeah, I think that's a really good point. I can speak to that with what happened in London. So London looked to build something called the London Cycle Network that then got shrunk to something of higher quality and called the London Cycle Network Plus in sort of very Orwellian terms. But that itself was a mistake, because what happened was all the easy bits got done first. To Kevin's point, it's very, oh, here's the wide road, we'll paint a bike lane along it, yeah? Because there's no political pain in that. And you end up with disjointed bits of network, and what wasn't tackled was the junctions, the intersections, which are the difficult bits. So absolutely look to a coherent network, and it might not be the ideal network, and it might not be a grand network, but it's an attainable network. And that will depend on the levels of ambition and funding. I suppose the second point, which counters that a bit, is London's recently invested in very big, heavily engineered cycle superhighways. Whereas over the last few months, what we've seen is when you get rid of the traffic, you don't need that. Yeah, you don't need that. You've just got to make hard decisions about who gets the space. And so, which depends on political will. And that becomes really hard. So you've either got to spend on your infrastructure to get that coherent network, especially at the junctions, or you've got to restrict traffic. Which takes me to my third, which is actually the alternative, a bit of an alternative, is to think more locally. And back to Kevin's point about, you need to do this so it works as a network. You can look at more neighborhood treatments, filtered neighborhoods, start there, do it really well. And often residents will support that, because who wants through traffic through their neighborhood? And it's much easier to get people's support because it's for them. And it's about walking as much as cycling. And you can then build out from that. And you've got something that becomes a beacon, and there's somewhere called Waltham Forest in London, and Mini Holland, so is now used across the UK as an exemplar of what can be achieved at relatively low cost, and something that most local people want as well. And doesn't necessarily involve taking away swathes of road space, but it does mean taking out through traffic.
Okay, thank you for that. Did you want to add anything to that, Haneen?
I mean, I'm not a practitioner, so going back to Alvaro's question about mistakes that cities have suffered from in the past, I don't know the answer to that. But you know, from a, I guess, research standpoint, the connectivity issue is one that keeps coming up as a good practice. Just making sure that your active transportation lanes, whether it's for pedestrians or cyclists, are segregated from traffic so people actually use them. Another thing that we've been recently thinking about, especially in areas where weather is an issue, is making this infrastructure suitable for the weather that's prevalent in your region. So for example, in dry and hot climates, maybe thinking about shading or vegetation barriers or some water bodies around them. So yeah, these are my immediate thoughts.
Thank you, and I think that leads in quite well to Kevin's question, I think now.
Oh, which question was that, Andrew? You have to remind me.
Yeah, the first one about getting more strategy in terms of the reallocation of street space.
Yeah, so I'm just kind of interested. 2 points here. The first one is, while it is important to talk about land use and density and the built environment and everything else, and I think that is almost as important as anything that else in cities, those are really slow to change. Streets are quick to change, and we need quick solutions now, and we can change streets quickly. Okay, so what types of strategies do practitioners, either in Ecuador or Sustrans in UK, what type of strategies will help them better understand that phenomenon, that streets can change very quickly, and what types of strategies will allow them to better realize the virtues of this kind of connected network that we're talking about?
Okay.
What are the roadblocks there?
Yeah. Do you want to go first, Xavier, on that one?
Yeah, the roadblocks is change, yeah, and people don't like change.
Yeah.
And you're taking something away from people fundamentally. So you're right, roads can change really quickly, but you're taking something away from people, and people hate having things taken away. You know, there's all sorts of social psychological evidence on that. So I think what can help is actually, so what is being able to point to success and being able to say, not going back to my set of London's not Amsterdam, not this happened in London, this happened in Amsterdam, or this happened here, but this happened in a neighborhood just like yours. So this happened in a neighborhood like yours with people like you. And what would be really powerful would be to take the people who were, you know, there's nothing more powerful than an ex-smoker, yeah? So to take somebody who was previously anti and who's now been convinced, and we have examples of small business owners who thought all their traffic came from cars and then it didn't. And that's a really powerful thing, as are photos of what Amsterdam used to look like in the 70s, with cars parked all over the pavement and everywhere. So I think practically speaking, that helps, but the battle is at a ward level. The battle is at a ward level. You know, there are areas of Copenhagen where the cycle lanes stop, and so it is a battle. And but I think that making it personal and realizing it's personal. The other thing I'd say to the mistakes thing, people kind of have to make their own mistakes. I mean, we've been working with cities that, and we can say till we're blue in the face, you don't want to do that to your side roads, but they've got to make their own mistakes, and they come back and say, we shouldn't have done that, should we? Well, no, of course not. And you know, we're all human, aren't we?
Mm-hmm.
So thank you. Thanks. Do you have anything to add to that, Alvaro, based on South American experience?
Yes. Yeah. Well, there are a couple of things. There are a couple of things that I would add to that. One is the narrative of solidarity that we're using here in Ecuador. Why are we locked in our homes right now? For solidarity, for the people who are actually going to need to go into the hospitals. Okay, and people, and that narrative is it's accepted. Okay, I'm staying here so that people who actually need to go to a hospital will use it. So we can expand that narrative in the sense, okay, we need cycle paths, cycleways for people who do actually need to use public transport, can use it in a healthy way without the risk of getting contaminated. Okay, so I think we are trying to use that narrative in order to get the city at the city level to build bike paths. So the narrative is important, and I think solidarity is very that narrative is helping a lot. That is one, and the other one is the ciclovías recreativas. I don't know if you heard of this project. That is a big ongoing project in all of Latin American cities that is closing streets on Sunday for people who can actually use them for active travel, for riding their bikes, running, rollerblading, and so on. So that's a good starting point. Do that on weekends, on Sundays. Right now, because of the COVID-19, Sundays all the cities are completely closed for traffic. So many people are using their bikes, and they're starting to see, okay, so maybe it's not that far away to use my bicycle. Maybe it's quite easy to start using it. So I think those two examples are really good to start on in order to break that. Don't take this away from me. I'm taking some space of this, but I'm giving you this in change.
Okay, that's really inspirational. Thank you, Alvaro. So we're getting a bit short of time here. I would like Xavier to ask one of his questions, and then we've got a couple of questions maybe that we can quickly take from the audience as well. So Xavier, you had a question about reallocation of road space between active travel and public transport. I think that would be quite useful to ask that one.
Yeah, so I guess it picks up Kevin's point about there being more and more demands on the finite commodity that's road space, and what we're seeing a bit of is conflict where public transport capacity is significantly reduced, and the government is advising people to walk and cycle if you can't drive. The bus, public transport operators, buses in particular, are feeling that there's potentially irreversible damage being done as space is taken away, and the impact of that on bus patronage, but also on future bus journey times. And I was just wondering if the panel had any reflections on how to manage that balance, because public transport is vital and will be vital to recovery and in the future, and it can't all be about walking, cycling, given the land use patterns we have, certainly. So how do we get that balance right?
Maybe Kevin, given your comments on mature systems.
Yeah, I guess my first reaction was to slightly contest the fact that we can't just rely everything on walking and cycling.
Okay, yeah.
Even in the US, we have very distributed, low density land use patterns, but even in the US, over half of automobile trips are less than 6.5 kilometers, which is a good cycling distance. So in higher density areas, I do think that we need to think more strategically about transit and what that's going to require. And not all transit systems need to have their own right-of-way either. So we can conflate some lower level transit systems with shared street space. So I think it's a very good question, and I think it's a very important element for the built form for those who are concerned about the built form to think through. But I wouldn't give short shrift to the new types of innovative mobility devices that are going to be forthcoming.
Okay, thank you. Do you want to add anything, Alvaro?
Yes, well, the context in Latin American cities that given the huge amount of share, the big share of people using public transport, changes that the thought of Kevin, in the sense that we cannot rely definitely only on walking and cycling. We need more people walking and cycling. We definitely do need walking and cycling in order to give more capacity to buses, to create more capacity to buses so that people can ride on them without the risk of getting infected. This idea of being infected in transport, because right now there's new literature that is coming out that is saying that if you use your mask inside of public transport, the risk of actually getting infected is really, really low. But anyway, what I do think is that it's a very difficult. There's not a simple answer for this. I do think that you need to find the right places where you need to give priority to buses. Definitely, you need priority for buses, intersections in those corridors where you have big, where you have big congestion problems. You definitely need to start creating capacity, more capacity for buses, and you have to build that capacity only with prioritization, definitely. And then you have to find the spaces for cycling and walking. This is not a fight about the car against bicycle. This is, okay, public transit and bicycle. Both of them are needed. Both of them are important. In the context of our cities, that's definitely the fact. You have to find the spaces. I would think that in our cities, you need to start thinking at the neighborhood level. Okay, at the neighborhood level, you build good cycle networks and walking networks, and then to start moving from neighborhood to neighborhood, let's start thinking about public transport and priorities for public transport.
Okay, thank you. So one question from John in the audience then, and maybe hopefully Haneen can answer this one. So has anyone done research into mobility and access to healthcare to quantify reduced healthcare costs, which can be used to justify increased investment in mobility infrastructure?
So I'm not sure, but I've seen research on mobility and access to healthcare and its impacts on health outcomes. So there's been a good paper a couple of years back from Charlotte Kelly from Uni of Leeds, where they've done a systematic review looking at how access to healthcare might change survival rates for patients and improve their health outcomes. And I think the conclusion was that it does. So, you know, implicitly, that would probably mean savings in healthcare costs. But I haven't seen research specifically looking at that. But I think implicitly, it would make sense that it does.
Okay, thank you.
There is the work of Tiago Guimarães from ITS. He just finished his PhD, and he actually looked at that in the city of Sao Paulo. And he's come out with a couple of papers about that particularly issue from his PhD research. So I would suggest Tiago Guimarães, look it up.
Can you type his name in the comment section?
I'm gonna try.
Okay. So whilst you're doing that, with time is quite short now. So if we could just ask this one question and maybe have quick responses from the panel. So we're already seeing motorized traffic building back up to the levels before March 2020. And people are learning to coexist with COVID-19. So what are the real actions that we can do to persuade people of global transport priorities to move in a more health and eco-friendly direction? So what can we do to kind of crystallize the changes that have been initiated? So would you like to go first?
I think it's going back to the topic of this roundtable. It's back to the health impact and the health equity of this. And you know, as Haneen talked about the health impact of motor vehicle traffic, of private transport, electrifying our cars, automating them is not going to take all that away. And we need to create healthy places so that we can have healthy people, and to create ultimately a healthy earth so that we can keep on surviving as a race. So I think that is going to come back into sharp focus as the emissions go back up and all the rest. And then it's the same interventions we've been talking about.
Lovely, thank you. Kevin, anything to add to that?
The public may not be the issue. The elected officials, I think, are the issue, because we have street space and they're the ones that are controlling that. So I think we have a responsibility as researchers and practitioners to broaden their perspective, open what has been often referred to as the Overton window, in terms of what is allowed and what is feasible for providing single bullet responses here. Okay,
thank you. And Alvaro?
Yes, I would suggest academia needs to find better ways to share their findings, easier ways to find what you actually do. It's not just a matter of putting it up on Elsevier. Find an easy way to read it, to access it, and in a way that it's readable, you know, and understandable. I think that is really, really important. I mean, my experience when I was in government for a little bit over 2 years, it was that if you have the data, if you have the right insights from empirical work, that really, really helps you out to take decisions. Of course, I come from an academia background, so for me and my team was a little bit easier, but you definitely need that input from academia in order to take decisions and give politicians that security about taking them.
Okay, thank you. Any final comments, Haneen?
Yeah, I think I want to kind of go back to Kevin's point about, you know, this is being a good turning moment. And I really think it is. You know, it's a crisis, but it is perhaps a moment that we can capitalize on. I think from a research standpoint, we're doing that by kind of tracking all the changes in activity or in travel patterns and health outcomes and environmental exposures, but also because it's true, this is an issue that elected officials have much more power on than the public. So, you know, from a practitioner's perspective, it also might be a good moment to push health up the agenda a little bit more. It's topical right now, so maybe think about it broader than infectious disease, but also try and promote and make use of like these changes that happened with, you know, how our streets look like right now and how our activity or travel patterns have changed, and kind of bring more awareness to what impacts have resulted from these changes, so that we get some sort of a momentum at the public level that might collectively eventually lead to policy change.
Thank you very much. So thank you very much to all our speakers today. It's been a fantastic round table, really good contributions from everyone. I had written a little summary, but I think we're kind of running out of time. But just to say that the health challenge of the not doing things around mobility is just too great to ignore, really. The key point here, I think, that Haneen made right at the beginning, is 10 times as many people die as a result of health-related mobility consequences as opposed to safety. So prioritizing on health is a real way forward in terms of encouraging a sustainable urban environment that's based around active travel. So thank you very much for your contributions. It's been, as I said, it's been a really good roundtable.